Welcome students to Crown Edge. I'm Dr. Pooja. We are going to discuss the endocrine system MCQs. We already done the lecture of the endocrine system, right? So let's start with the question answer session. The first question is vasopressin is synthesized in. So we know vasopressin is also known as antidiuretic hormone, and we learn that all the hormones are produced in the anterior pituitary, but there are two major hormones which are secreted by your hypothalamus. So this is the one of the hormone which is secreted by the hypothalamus. So hypothalamus produce the ADH, that is antidiuretic hormone, or vasopressin you can say, right? And what is the next one? The oxytocin. So whatever other hormones they give, that is either secreted in their own glands, right, or they are secreted from the anterior pituitary. But the ADH and oxytocin, these are the only two hormones which are secreted by your hypothalamus. Now, the clinical question, a student is scared to give the exam. So just before the exam, so he is scared, right? So just before the exam, which one of the following hormone is secreted into his body due to fear? So the fight and flight response, we remembered about that, right? So in the fight and flight response, which hormone is secreted? Your catecholamines. And we know the catecholamines are of three types. What are those three types? First is the epinephrine, norepinephrine, and dopamine, right? So these are going to be secreted either you are doing a very exciting work, or you are scared of something, right? So fear hormone or the hormone which is secreted just before the excitement, both are nothing but your catecholamines. So which one of the option can be the answer? The answer over here is option B, right? Other hormones has nothing to do with the fight or flight response. Okay, in hilly areas, the children do not eat, if the children do not eat the iodinated salt, the risk of which of the following diseases higher? So iodine is required for which hormone synthesis? We talked that iodide form which are there in the salt, that will be converted into iodine, and this iodine is very important for your thyroid hormone production, right? So if the child in the hilly areas, what happens is that there is no iodine per se in the local salt, right, which is there. So what happens if they do not eat this iodine? Definitely the hypothyroidism will occur, and hypothyroidism in the children, so that hormone will lead to the deficiency of that hormone is lead to something known as the cretinism, right? So that hormone lead to cretinism. So answer over here is option B. Let's talk about the other diseases that they gave over here. Acromegaly. When we talk about acromegaly, we learn in the lecture the mnemonic, how to remember, right? So over here the A is there, right? So this condition is going to act in the adults. So if the adults having the hypersecretion of that, so that will lead to acromegaly, right? And similar with the gigantism with a bigger person, that will not happen in the hyposecretion, right? They ask about the hyposecretion. So hypersecretion due to excess of iodine, which will lead to excess of creation of the salt, that will lead to that. And if the hypersecretion is there, something known as myxedema will occur. We talk about the exophthalmos, right, as if the eyes are coming out, right? Eyes are popping out because the interstitial fluid is accumulating the water, and that is known as your myxedema. Everywhere the hydrostatic pressure will increase, and that will lead to accumulation of excessive water into interstitial fluid, right? All the diseases we already talked into the lecture or discussed it. A disease of the adrenal cortex, it will leads to the deficiency of cortisol production. So it leads to, so what they are wanted to ask is deficiency of cortisol will lead to what disease? So if the cortisol is increased, it will lead to Cushing syndrome. Graves disease, we talk in terms of the thyroid, right? Whenever thyroid toxicosis, means excessive level of thyroid, abnormal high levels of thyroid, that will lead to Graves' disease. This Addison disease is leading because of the decreased level of the cortisol. So answer over here is option C. The next question, which of the following hormone decreases both serum calcium and serum phosphate? We talked about that chart, if you know that. Vitamin D, what it does, it increases both serum calcium also and serum phosphate also, right? Then the parathyroid, it increases the calcium level in the blood but decreases in the phosphate. The calcitonin decreases both, and cortisol does not include in the calcium regulation. It does not play any part. So answer over here is option B. Next question, which one of the following increases the sensitivity of the heart to epinephrine? So, you know that epinephrine is going to activate the sympathetic system. We talked about that, right? Because it is a catecholamine, flight and flight response, remember? So, sensitivity of the epinephrine is increasing. That means your sympathetic system is activating. So, who helps down the activation of, further activation of sympathetic system in the heart? So, that is nothing but your thyroid hormone. See, parathyroid does not have any role in sympathetic and parasympathetic. Same with the somatostatin, which is growth hormone, inhibiting hormone, right? And glucagon, which does take part in the glucose, increase in the glucose into the blood, right? So they do not have any role in the sympathetic system. But you know, hyperthyroid people, they are very, very hyperactive, right? So that means they are having the excessive activation of all the systems, right? So we talked about in the thyroid, if the thyroid levels increases, the BMR increases, the CVS system is getting more and more activated, right? Same with the respiratory system also. So this is helping into the activation of sympathetic system, which acts through the epinephrine. So you can put the logic and you can answer the question. Next question, which one of the following hormone is highest? They asked just before the ovulation. We saw a chart, right? We talked about FSH, LH. We know that FSH is more during the first phase, right? Which does the production and maturation of the follicle. And the LH, we saw near the day 14th, we have increased LH secretion, which is known as LH surge, which helps in the ovulation. So answer over here is option A. Next question, which one of the following enzyme will help in the formation of the thyroid hormone? Thyroid hormone formation, we talked about a lot in detail in the lectures. So we must be identify what is that? That was the thyroid peroxidase, which is known as TPO. Only this enzyme we talked about because this is the only enzyme which help in the thyroid formation. All other enzymes, they are not at all present, or even they are present, they are not helping in the thyroid hormone formation. So answer over here is option C. Let's move on to the next question. Which one of the following hormone is responsible for ejection of the milk? We talked about the production of the milk after the baby is born, right? So what will happen? The production, P for P we talked about, right? So prolactin helps in the production of the milk, right? And ejection, that means the blood exits from the mother's breast with the help of the hormone, which is known as oxytocin. So how we made the trick? P for P, right? P for production of the milk, which is happening with the prolactin, and ejection or exiting out with the help of oxytocin. So answer over here is your oxytocin. Why? Because they asked about the ejection of the milk, not the production. The clinical question, a person migrate to a place of cold environment. So what is important over here? Cold environment. What is the mechanism via which his body will try to compensate and prevent the heat loss from the body? So we have to identify which is the method by which our body prevent from the heat loss. Why? Because it wants to conserve the heat to compensate with that cold environment. So let's go one by one. Sweating, vasodilation. These two processes will help in the heat loss. They're not going to prevent the heat loss. They will do more and more heat loss, right? So these cannot be the option. If they are not the answers, so all of the above that cannot be an option. So what happens actually is peripheral vasoconstriction. We talked about peripheral vasoconstriction very much in the depth. Answer over here is option C. Why? Because the vasoconstriction cause less and less blood to flow in the periphery, right? And if less and less blood is flowing towards the periphery, the heat loss will be reduced also, right? So answer is vasoconstriction. Which one of the following hormone leads to activation of osteoclasts? We talked that osteoclasts are bone eating cells, right? So which one will activate them? Growth hormone has nothing to do with the activation of osteoclast, and when we activate them, whenever we want to regulate the calcium levels, right? So calcium regulation in that mechanism, growth hormone plays no role, right? And similarly oxytocin also not playing any role. So two hormones which plays role is calcitonin and vitamin D. Vitamin D, we talked that it increases the calcium levels, right? And the calcitonin, it decreases the calcium levels in the blood, right? So we're talking about calcium levels in the blood. So what happens if the calcitonin is increased? They deposit the take the calcium and they deposit into the bone, right? So what will happen? The calcium levels will be low in the calcitonin, right? And activation of osteoclasts leads to increase in the calcium level. Why? Because they broke down the bone and take their calcium and give it to the blood. So what will happen? The vitamin D, which is also known as 1,25 dihydroxycholecalciferol, it is going to activate those osteoclast cells. So moving on to the next question, what they ask is which one of the following is the anterior pituitary hormone except. So we want to exclude whichever is not the anterior pituitary hormone. So let's see one by one. LH, yes, it is secreted by the anterior pituitary and we talked about it, right? FSH, yes. TRH, no. And GH, yes. That means the answer over here is option C. See, we talked about the stimulating hormones that are released by the pituitary, right? So if this would have been TSH, then TSH is secreted by the pituitary, right? But over here they gave the option TRH. So all the releasing or inhibitory hormones, right? They are released by the hypothalamus. So they are released by the hypothalamus. And once this, they will stimulate this pituitary, right? And once the stimulating hormones are released by the pituitary, they are going to act on the glands, right? In the case of this thyroid, let's see what is the axis. The axis is like this. So first is the hypothalamus, which is going to release the TRH, right? Then comes your pituitary, which is going to release the TSH, right? And then comes your thyroid gland, which releases your thyroid hormone, that is T3 and T4, right? So answer over here is your option C. So that's all about the question answers of endocrine system. Thank you.